I would like to welcome you to my channel, That Middle-Aged Lady. My name is Denise, and in today's video, I wanted to share my experience after recently having a cystoscopy done due to my doctor finding some microscopic blood in my urine. But before I get started, I first wanted to explain exactly what a cystoscopy even is, what type of doctor performs it, why might it be ordered, and perhaps the most important question that most people wonder, does it hurt? So what exactly is a cystoscopy? A cystoscopy is a procedure where a thin, flexible tube called a cystoscope is inserted into the urethra, which is a tube-like structure that transports urine from the bladder and out of the body. In a woman, the urethra is typically 3 to 5 centimeters long, whereas in a man, the urethra is typically 16 to 22 centimeters long. Either a man or a woman can have this procedure done. What type of doctor normally performs this procedure? It is typically performed by a urologist who specializes in matters of the urinary tract, including the kidneys, ureter, bladder, and urethra. It can be performed in a doctor's office or the setting of a hospital. Why might a cystoscopy be ordered? It is ordered to help diagnose and monitor a variety of urological conditions in both the bladder and urethra, such as bladder cancer, kidney stones, urinary tract infections, or UTIs, and enlarged prostate in men, and urinary incontinence. It is also used to help investigate the cause of blood in urine, referred to as hematuria, either microscopic, where you can only see it through the lens of a microscope, or gross, where you can see it with your eyes. Is a cystoscopy painful? The procedure itself should not cause any pain, as that area should be numb first, although you might feel a little pressure as the cystoscope is being inserted into the urethra. From beginning to end, the procedure should only take a couple of minutes, unless another procedure is performed along with it, such as a biopsy. Although men might feel a little more discomfort than women, both a man or a woman might experience a little bit of burning when urinating after the procedure, along with a little bit of blood in the urine, both of which is normal. How this got started for me is that I started to experience some burning when I would urinate that felt like I had a bladder infection or a UTI, because I have had plenty of UTIs throughout my life and knew exactly what they felt like. I called the doctor's office to see if they could call me in a prescription to save myself a trip from having to go to the doctor's, which they said that they could, but that I would need to come in and leave a urine specimen at some point before starting the antibiotic so that they could look to see what type of bacteria was in there, just to make sure that they were treating it properly. Of course, this kind of defeated the purpose of me wanting to save myself a trip from going to the doctor's, but at least I wouldn't have to wait to see the doctor and could do it at my convenience. So I went and picked up the prescription, made a quick stop at the doctor's office, left that specimen, and then got a phone call back a couple hours later with them saying that I did have some microscopic blood in my urine, which can be indicative of a bladder infection, but that I also had some white blood cells in it as well, which is referred to as leukocytes. Because of this, they wanted to go ahead and send it out for a more advanced culture just to see exactly, again, what type of bacteria was in it. And then they would get back to me, but they said to go ahead and start the antibiotics just because I did have the microscopic blood and white blood cells in the urine. They ended up calling back a couple of days later to say that there was no bacteria found in the urine, which means that the burning was not caused from a bladder infection. And because any type of microscopic blood in the urine, either microscopic or gross, needs to be investigated for the possibility of bladder cancer, since blood in the urine is one of the main symptoms, they wanted to refer me to a urologist. So I got in to see him about a week later, where he confirmed I did in fact have some microscopic blood in my urine and then the leukocytes as well. And so he wanted to do or perform a couple of different tests just to kind of see what might exactly be causing it. The first thing he ordered was a uroscan, which is basically a CT scan of both kidneys, ureters, bladder, and urethra. And then the results came back that the bladder and urethra looked fine, although sometimes a cystoscopy is ordered along with that, just because the CT scan doesn't always pick up small things, say like a small tumor. And then it also showed that I had a 3-millimeter kidney stone in my left kidney, along with a cyst that I was diagnosed with previously, and that I had a little bit of hydronephrosis in my right kidney at the renal pelvis. And so the renal pelvis is a funnel-like structure that we have in both of our kidneys that collects the urine before sending it down to the ureter. So in my case, I had just a little bit of swelling where that renal pelvis met the ureter. And this is a diagram of what that looks like for anybody who might be interested in seeing. I was also diagnosed with that same thing about 5 years ago, which is actually referred to as an extrarenal pelvis, which sounds so confusing and ominous. An extrarenal pelvis, what the heck does that mean? But basically what happened in that case is the urologist I had seen during that time did exploratory surgery and said that he believed a kidney stone made its way down, and when it did, it kind of kinked that ureter right at the renal pelvis and caused it to kind of bulge out a little bit. Kind of like when you go to use a garden hose and it gets kinked. It doesn't, the water doesn't flow out of there as fully as it should, but then as soon as you unkink it, it flows at normal, rate again. Same thing with my ureter. The kidney stone, for whatever reason, kind of kinked it a little bit. So rather than all that urine draining out, it caused it to back up a little bit and bulge out, therefore causing the extrarenal pelvis. And so during that exploratory surgery, the urologist put in a stent, and I had to have that stent in for about 6 months. But then once it was taken out, everything went back to normal, and I haven't had any problems until now. I did make my current urologist aware of the fact that I did have something similar happen 5 years ago, but because it has been 5 years and a lot can change between then and now, he said that he would have to investigate it as something altogether new, which I completely understood and agreed with. The day of my appointment, once I got into the exam room, I did do just a quick little video just to show everybody what to expect and a little bit of what the procedure entails. And so here's that video now. The first thing I noticed was an exam table that had a paper sheet on top. I was told to undress from the waist down and then to drape the paper sheet over me. When the nurse came back in, I asked if she could explain the procedure to me. So she said the first thing she would be doing is to take a swab of iodine and swab the urethra just to kill any bacteria, and then she would take a syringe with no needle and squirt a little bit of numbing solution to the urethra to help numb it. To the right of me was the cystoscope, which is typically 6 to 12 inches long. At the tip of it is the camera. On the other end is the lens that the doctor would look through. I was hoping that the pictures would be displayed on some type of monitor, but he would be the only one who would be able to see inside of there. He would then fill the bladder up with a saline solution to open it up so he could see inside of there, and then either he would drain that or you would pee it out. Then once the procedure is over, he takes the cystoscope out. So once the cystoscopy was over, he told me that the bladder looked fine, the urethra looked fine, he didn't see any issues with them whatsoever, which I have to say is one nice thing about having the cystoscopy done in the doctor's office is that you get the results before you leave, whereas with a CT scan, you have to wait for somebody to read it and then for somebody to get back with you, and sometimes that can take up to a week or two. So it was nice to be able to leave the doctor's office that day and have the results. From there, he wanted me to have a kidney scan done with vascular flow, which is a nuclear test that tests the function of the kidneys to see how well they're working. And I did just have that test done as well, and I'm about to upload a video on it. So if that sounds like something you're interested in hearing more about, I hope you'll look for it and check it out. But as far as the cystoscopy goes, if you were to ask me on a scale of 0 to 5, 0 being no pain whatsoever, 5 being the worst pain I've ever felt in my life, what I would rate this, I would definitely rate it a 0. Other than knowing that it was being inserted into me, which I think mentally you're kind of bracing for it, but other than knowing that it was being done, I felt 0 pain whatsoever. Didn't feel anything going in, didn't feel anything when the cystoscope was coming out. And then afterward, I didn't experience any type of burning whatsoever, nor any type of blood in my urine, other than obviously the microscopic blood I was already diagnosed with. Obviously, I can only speak as a woman, so I can't really say how a man would fare when having this test done, since a woman's urethra is much shorter than a man's. But considering they do numb the area, I can't imagine that it's going to be much different for a man. And so if you have also recently been ordered to have this test done, I would not worry about it. I definitely had myself worked up the night before, mainly because the last one I had, I was put under anesthesia, so I didn't feel it nor remember it. But this time, I can honestly say, especially because it only lasted maybe a minute or two from beginning to end, it was no big deal whatsoever, and definitely not something that you need to be getting yourself worked up for. And so I hope you found the video informative and it answered some of your questions. But if you have any other questions, please feel free to leave them and I'll be happy to answer anything that I can, along with any comments, as I do respond to every comment. And other than that, I just want to thank you so much for joining me today, and I'll look forward to seeing you next time.